Botox truly becoming the new multivitamin for women, maybe over 30s? Is it something genuinely preventive, or are we giving into Instagram pressure?
It is kind of like a multivitamin, right? Because multivitamins, why do you take it? So that you feel good. Botox also makes you feel good. And the thing with Botox is that it is preventative. In fact, I was part of the first study ever which talked about the preventative benefits of Botox and how, if you start early in micro doses, you can actually prevent lines, wrinkles from coming up. It's not about freezing the face, it's just about having a rested appearance, right? And so Botox is preventative. And it's not only just about lines and wrinkles, like underarm sweating and body odor. It has a great role to play in that. It reduces.
How does Botox help underarm odor?
Yeah, so when you sweat,
Yeah.
there's bacteria, it causes the odor. So Botox actually reduces sweating. And when there's reduced sweating, you have no odor. So it's great for underarm odor. It's great for people, some people have that wet palms and you shake hands, or wet feet and they have stinky socks.
So
All of
the,
that.
the condition where people genetically are prone to sweat on the
Hyperhidrosis.
hyperhidrosis, can that be treated with Botox?
Of course it can. Botox is a known treatment for hyperhidrosis. So we do that. I have a patient who's a teacher, right? And he's a very renowned professor, actually. But you know what? He sweats a lot. And he gets in front of the stage or in front of his students, he starts sweating and he has to keep dabbing it. So we actually Botox him in his forehead so that he doesn't sweat. And he looks fresh. And he has his expressions because he has to be angry at his students. He can still emote. We've not frozen him, but we reduced the sweating.
So Botox also is in the hands of an artist.
It is art. Botox is not just a drug that's injected. It's an art. If you have the right doctor, the results are fabulous. You have the wrong injector, it's disastrous. And Botox is not taught to people in medical schools or derm schools or surgical schools. It's a learned skill that you learn outside because, aesthetics is not a course that we study in medical schools. So you need to make sure that your injector is a physician first and foremost, is a doctor. Second, that they were specifically trained to inject Botox and to inject fillers.
I remember I'd gone to Dubai one time, and at the spa over there, they were talking about Botox. And I said, do you have a doctor in here? Said, no, our beauty technicians are trained to give the filler injection. And I was like, that doesn't sound right, especially in the city of Dubai.
It's the city of Dubai. Why? It's all over India. Salons are doing Botox fillers, injectables, PRP, where they're drawing blood, they're giving IV. Everything's very scary, right? Because things can go wrong. Like if you don't put the Botox in the right muscle, you can actually hit the wrong muscle. So your lid could drop or your expressions can change.
And is that permanent?
No, it's temporary because Botox only lasts 4 to 6 months, so it wears off. So that's the good thing. But fillers, if you put it in the wrong area, you can actually cause a trauma to the skin where the circulation reduces and that can cause ulcer. Similarly, if you're giving an IV and the person puts a bubble in there, you can give them an embolism and they can die with an IV drip. So there's so much disasters. A laser light, if it's not done properly, if it shoots into your eye, it causes blindness because they're level 4. So sadly, we don't have the rules and regulations that are being enforced. There are rules and regulations. It's not enforceable because India is such a vast country right now. And so I always tell this, but I put the onus on my patients too. I'm like, you're literate. You should know better. If you go to a salon or you go to like a mall and then there was a small little shop where they were doing nails and eyebrows and stuff and you went and got your injectables there, why are you complaining if you had a side effect? You should know better. You should also take the responsibility for it.
So I've been hearing a lot about exosomes. What are they and how are they used in your skin treatment?
Exosomes are like our newest it product, right? It's a drug. It's a newest it. And exosomes are nothing but messenger cells. They carry a load which gives a message to your cell. Exosomes are loaded with a lot of growth factors which tell your system that it needs to repair, it needs to heal, it needs to grow, and also anti-inflammatory factors. So it's just delivering a message directly to your cell. It's kind of like having a direct line to God, in many ways for us. So it's fantastic because the basis for most skin and hair conditions is inflammation. and exosomes work on the anti-inflammatory pathway. So it's great for acne, for pigmentation, for helping with scars because we get better skin quality and skin regeneration. For growing hair and thickening hair, it's fantastic. It's good for, like, we were talking about dark circles, all of that, and even rosacea. So anywhere there's inflammation, it's really good. Now, there is quite a lot of data on exosomes and a lot of trials that it's happening. But the quality of exosomes, the source of the exosomes matter, and they're not a beauty product, they are a drug.
So it's a pharmacological
It's a
product.
pharmacological product. A lot of people will talk about exosomes, there's plant exosomes, fruit exosomes, fly exosomes, etc. So there's a differentiation. Plant, fruit, flowers, etc., botanical exosomes. They're similar, identical, but they're not the true exosomes. The true exosomes are usually derived from either your blood, like platelet, bone marrow, adipose tissue, which is fat, or umbilical cord. And they really are actually introduced into your skin through a microneedling device, or into your hair, and that's how they work. It's the new realm of bioregenerative therapy.
In fact, my face started, we did one treatment with microneedling, and then Pooja put the exosomes after that.
Yeah.
And she said, don't wash your face.
Yes.
Don't wash your face. I'm like, how can I not wash my face? She
Just
said,
for 8 hours.
yeah. She says, no, because I finished at 6:37 in the evening. She said, don't wash your face. I'm like, I have to go to sleep. She says, don't wash your face. Go to sleep like that. And then she explained to me that the exosomes will be there and they'll do the rejuvenation after the microneedling. And she was right. The next morning, you could see that in the face,
Yeah, the glow. With exosomes, they're still new. So they are a little bit more pricier than doing like a PRP treatment. But
so PRP is where you take out your own blood and
the
you
vampire facial that everybody talks about.
You take out it and you concentrate your platelets, right?
Yeah, we take out the blood and then we separate out the different layers. And there's one layer which is called the buffy coat, which is very strong with growth factors. So typically, if I had to put it in layman's language so people understand better, a good PRP, a good one, can give us about maybe like 100 million growth factors. Exosomes can give us anywhere between 1 to 10 billion growth factors.
Whoa, it's that powerful.
It's that powerful.
Wow.
Yeah.
I think I'm booking up an appointment for some exosome treatment.
But not all exosomes are equal, right? You can't compare an apple and a pear. So it's the same thing here. So when a doctor tells you exosomes, also be aware which exosomes you're getting.
So what question do I need to ask the doctor?
You need to ask them what is the source for their exosomes, how many growth factors are there in your exosomes, and is there research and data.
Can you tell us like what are the 4-5 top exosome brands that are used in the world?
I'd love to tell you which exosome to use, but I don't want to because they're drugs, and ideally,
it's like telling a person, oh, this antibiotic is very good for a cold, and then everyone goes and gets it themselves.
Exactly. So please talk to your doctor today, and they'll be able to guide you on the best exosome for your skin.
Okay. Any other new treatments that are coming along the way?
Right now, polynucleotides are the big thing. Salmon sperm facials, right?
I heard about that.
Yeah, it used to be vampire facials. Now it's salmon sperm. Why? Because polynucleotides are, again, highly densified growth factors, but they're derived from the sperm of a salmon. Can you imagine like a salmon fish and then it's sperm and then you take out the growth factors? But that's what it is. So it's actually very regenerating and rejuvenating to the skin. Great for scars, great for people with problematic skin, for open pores, etc. And it's really good for just your quarterly maintenance of your skin. And again, you do a microneedling and you deliver the product, apply it after that. And it's fantastic. So vampire facials out, salmon sperm facial in.